Welcome to Orthodontic Smiles, the podcast designed for all dentists and their staffs who practice orthodontics. This podcast is brought to you by the American Orthodontics Society. Today on Orthodontic Smiles podcast, we have Dr. Chris Baker. She's a graduate of the University of Kentucky School of Dentistry and a pediatric dentist and graduate of University of Connecticut. After her pediatric training, she pursued a fellowship in orthodontics at the same university. She went into practice in pediatric dentistry in 1991 with Dr. Walter Doyle, a very famous pediatric dentist who became an orthodontist and was the first dual-trained pediatric dentist orthodontist with an incredible interest in early treatment orthodontics. She's a member of the AOS, the American Orthodontics Society, and a diplomate and senior instructor and past president. She is truly a Renaissance woman and a friend. Let me introduce to you Dr. Chris Baker. Welcome, Dr. Chris Baker. It's such a pleasure to talk to you. It's always a pleasure to talk to you, one of my colleagues in the American Orthodontics Society, and you're back in the USA. I'm so happy for that. We'll get to how you left the USA and then came back, but let's go back in our history a little bit, Chris. I mean, this is your name has been part of my life for many years, back into the 90s. Our connection is through my mentor, Dr. Ken Snodder, who was the chairman of the Department of Pediatric Dentistry, and was very good friends and a very close colleague with your boss at the time when you went into practice in pediatric dentistry, Dr. Walter Doyle. And at that point, there was a course that was developed between you, Dr. Doyle, and yourself, and you taught orthodontics, the two of you, for many years.
Yes, sir.
Tell me about that. That was a wonderful time, and a time that I came to respect the work that you and Walter Doyle did.
Well, yeah, Eddie, that was just an amazing time, because what it did was give me a totally different perspective on orthodontics, because Walter was the first pediatric dentist and orthodontist to be boarded by exam. There was somebody that got grandfathered into both before him, but he was the first one to be boarded by exam in both specialties in the world. And so I was in a unique situation to be able to learn and grow and get all of the wisdom possible from him. So that was really an amazing time. And he was most interested in life-changing, transforming orthopedics for children. So he had practiced
one of the innovators of early treatment orthodontics.
Exactly. I was going to say, after 12 years of practicing pediatric dentistry, he said, I realized that we're missing out on something. We're not taking care of the growth and development that orthodontic and orthopedic needs. So we've got to look at early treatment. And we used to say early treatment, and then people say, oh, yeah, it sort of implies too early. And he said, no, not at all. In fact, that's what we should be doing. So for me, it was life-altering as well, as I learned from him and worked with him. It was wonderful.
Yeah, and you're still teaching some of the things that you both lectured on.
Oh, absolutely.
It's really amazing stuff. He was an innovator. There's no question about it. And you as well, because the course that you taught was probably the very first course offered out there for general dentists and pediatric dentists to learn orthodontics. That was really...
I think so.
I don't think there were very many other courses. They may have been other courses that let pediatric dentists and general dentists into it, but this was actually designed for general dentists and pediatric dentists.
In fact, Exactly right. In fact, interestingly, I think Dr. Ricketts did have a course that welcomed both GPs and pediatric dentists. But as you said, this Walter's course was geared toward the pediatric dentist specifically. But interestingly, what happened was he actually did several early treatment seminars in Chicago, big, hotel rooms full of weekends that really weren't part of his seminars, getting people to really be aware of what could be done out there. And he was absolutely an innovator. You're right. And practically at the time, the whole Southeastern Society of Pediatric Dentistry had taken his course, before I actually came on board.
I was one of them. There's no question about it. He always impressed the heck out of me. He actually lectured to the AOS at one point. I don't remember exactly where.
Yes, I was there for that.
Yes,
I was there for that. He did fixing.
And I think that's when you actually started to get involved with the AOS, wasn't it?
It was indeed. It was indeed.
Well,
absolutely.
We obviously, the AOS is very happy that you did, because you've taught so many wonderful courses to so many people. And they're comprehensive.
You. It's been absolutely my honor and pleasure, believe me.
No question. I mean, there's so many people out there that still admire the courses that you've taught. But you taught for many years. You rose in the ranks of the American Orthodontics Society to the point where you became the president you were on the board of directors, and then became president of the American Orthodontics Society, and then served as on the board of examiners, and then became the president of the board of examiners. My goodness, Chris, you've really reached the pinnacle of about as high as you can get in the American Orthodontics Society. And then kind of all of a sudden, Chris Baker wasn't teaching in the U.S. So tell me what happened.
Well, the American Orthodontics Society actually sponsored what they called then in the United Arab Emirates in Dubai a, quote, mastership course, which was actually a name given to the course by the fellow who put it together for the doctors in Dubai. And we had about 75 doctors that were basically in two different groups over a 2 or a little bit more than 2 year period who took that course. So Claude, my husband, and I were traveling back and forth, as you know, to Dubai, and it was quite a wonderful experience. We learned a lot about the United Arab Emirates and the gracious, wonderful hospitality of the people and the doctors that were there. And B, we learned an awful lot about orthodontics in that part of the world. But that kind of took me away for a while, and I was still doing the courses. And then it led to other American connections, including the opportunity and the request to start the pediatric orthodontic division at this, where we are now, at the Advanced American Dental Clinic is what it's called. And there I found Kentucky connections, which is funny because you and I both have Kentucky connections.
Absolutely.
The doctors that I work with, a couple of husbands there, Kentuckians, and then Texas connections. My gosh, so many of the patients at the American Dental Clinic are Texas connected because they're in the gas and oil industry, or they're physicians, or they're attorneys, or they're other professionals, accountants, and so forth. So, yeah, it's been quite an interesting experience, and we've spent probably 2/3 or a little bit more of our time there during each year, which not in one swoop. I mean, we go back and forth some, but it's a pretty overwhelming challenge to treat patients there and be back and forth to home in Texas.
When did you start? When did you start going to work at the American Clinic?
Okay, that was about 5 years ago. After we did the courses in Dubai, that was about 5 years ago. Actually, a little bit over 5 years ago. Started working at the American Dental Clinic with setting up the pediatric. When I say pediatric orthodontic division, they had some adult patients because some of the general dentists were working with an orthodontist who has retired since, a fellow from Wisconsin, and he was there for a while, and he was working with adult patients mainly to set them up for implants and that sort of thing. But they didn't have anybody treating adolescents and even children, and so that was where I came in. So that was about 5 years ago.
Were you doing pediatric dentistry, or were you doing orthodontics only?
When I first went, they asked me if I would help cover some of the pediatric dental needs because they didn't at that time have a pediatric dentist. They had, I beg your pardon, they had one, but she was doing a lot of general dentistry. But now we have 2 pediatric dentists, and so it was only the first few months that I was involved in doing actual pediatric dentistry on any regular basis. But I still have my patients. You and I both know, Ed, you get those special patients that follow you. And, I have I have a couple of autistic children. I have a few children with special needs. And I have sometimes nobody else in the clinic is going to touch a 2-year-old or a 3-year-old who has needs that they're just not going to handle. So I do still occasionally get in there and do what I can do and what I'm good at, because after you do it for so many years, it just becomes like second part of you. So
yeah, it's interesting because I've sent patients to you when I knew some of my patients were going to Dubai, and you've sent patients to me when you knew they were moving back to Tampa.
Exactly. I was going to tell you that. That's what's been so amazing that there we were, and 2 sisters come in at first from you, and and it's funny because I asked them, so I see on their health history, I ask nationality, and I also ask ethnicity because I need to know about the norms, for their growth. And so the nationality said American. I said, oh, so where in the United States did you come from? Well, Florida. And who was your dentist? Dr. Eddie Gonzalez. He sent us. Oh, it is amazing. And the same thing with
small world, isn't it?
It's
a small world.
It is.
And then our techniques are so equivalent. And from our education, that it made it so easy. I knew exactly what you had said to them, and you knew what I had said to the moms. It's seamless. Yeah, it was actually seamless, which is wonderful. But you've taught so many people over in that area, from Iran, the United Arab Emirates, Oman, yes. that whole area there.
Bahrain,
what a wonderful thing. And then so many of them actually traveled back to the United States at one point to attend one of our American Orthodontics Society meetings. And it was wonderful to meet them all. Great? What intelligent and what wonderful and warm people came from those countries. I really enjoyed being with them. And let me tell you a little sideline. You know that you're on Orthodontic Smiles podcast, which is I'm so happy you are. This thing is, I think you're going to be maybe our 10th or 11th episode since we've gotten started. And I've got to tell you, Chris, I am so happy and so thankful to all the people that are out there that are listening to us. We're now in almost 80 countries in the world, where at least one or 150 people are listening to Orthodontic Smiles podcast. Dentists from all over the world are listening to us, and it's very heartwarming.
Isn't it amazing?
It's amazing what this computer stuff is doing to education, but we're so happy that they're listening.
For sure. And what you are doing, what you have done, Eddie, to make it happen, you must be very commended for making it happen. It's fantastic. Absolutely. Because we share knowledge and experience and love with all of these different colleagues all over the world. I mean, it's outrageous. It's wonderful.
Yeah, it is.
So thank you for that.
Well, thank you very much. I mean, you're not a neophyte to this internet world. You're an actual a blogger and vlogger, as the term goes, and you're in touch with hundreds, if not thousands, of people all the time on your blog. Tell us about that, and let us know how we can sign up for your blog.
Well, first, let me tell you what's interesting. I've been here in Texas for about 3 weeks now, and during this time, each morning, because there's about a 9 to 10 hour, depending on which part of the country we're in. Here in Texas, it's about a 9-hour difference. So in my mornings, it's their afternoon in Abu Dhabi. So when I first get up, and I get up pretty early because of the jet lag, so I'll get up at 5 o'clock a lot of times, until I get used to the time zone here. Well, I check my email, and my staff, because I have 6 dentists who work with me in the orthodontic division, and they will send me emails with photos. This patient came in, and we did thus and so. Is that okay? Is there anything else we need to do? We're waiting on any further instructions from you. So talk about the internet world, right? We're treating patients, long distance, very, very long distance. So that's kind of interesting. As far as the blogging and the video blogging or vlogging, like you said, as we call it, that's been wonderful because it allows me to get out there and say what I have to say that might help someone, what should help someone. I mean, if we share what we know and think and believe and understand and our experience and our wisdom and our love, then what we're doing is giving each other a chance to do more for the patients with which we interact and treat. So that's really an exciting thing.
Yeah,
and I love doing it.
And you should, and you can please continue, because I read them all the time. And you know what it does? It just helps me reflect on, you always talk about the happiness and love of treating patients. And that's something we don't sit back and think about sometimes. It's
true, and yet that's what we're doing every single day, isn't it?
It is.
You know, we are. I mean, it's amazing that we spend our days treating people and taking care of people. And for you and me, and for all of us as pediatric dentists, we're not just treating the child; we're treating the parents. We are taking care of the parents. We're not treating them dentally necessarily at all, but we are constantly interacting with parents, and probably more in some ways than the child.
Well, you know what? You know how you really get that feeling that all of that has happened is when you're getting your second and third and now my fourth generation coming back to you, looking you up on the internet to see if you're still in practice and coming to your practice. That is just amazing. It's so heartwarming to know that these people think that much of you and that you did so well for their children, their grandchildren, and now their great-grandchildren. It's wonderful.
Absolutely. And the other part of that, you're so honored by that, and you're right, and we feel so good about it. And then we turn around and go, but we did do a great job for them. Thank goodness we have the God-given ability to use the smarts that we got given and to use the opportunities that we had to change these people's lives. And we should be happy to do it and keep doing it and have these referrals and the rest of the family, because they are lucky to have us. That's what's so amazing. Well, and sometimes we feel like, well, that doesn't sound very humble, but that's the truth.
No,
you know?
Well, it is. I'll tell you a little side note here. A couple of weeks ago, I went to a dinner with my about 10 or 15 of my high school graduates. We graduated together from Jesuit High School in Tampa, and we went all together, and every one of them was retired. And they kept saying, Eddie, when you're going to retire? And I said, well, let me ask you a question. What do you do every day? And they said, nothing. Right. We don't do anything. And I said, you don't do anything? I mean, no, we get up in the morning, we have our coffee, and then we watch TV, and I plant some plants, but I don't do anything. And I says, well, you know what? I still got a gift that God gave me, and I'm just going to keep doing it until I can't do it anymore.
Exactly.
So
exactly right.
I don't think I'm going to retire until somebody taps me on the shoulder and says, Ed, maybe you ought to retire. You know, but I'm happy doing what I'm doing, and I enjoy doing what I'm doing, and you know what I really enjoy, and I know you do too, is teaching what we learn. Exactly, because we affect so many more children and people's lives by doing that, right? Well, let's talk about treatment.
What we're doing.
Let's talk about treatment for a minute. I mean, I've kind of lost in these past 5 years. I've kind of lost touch with you as far as your actual treatment. What has changed in the way you practice these days? I know what's changed in mine, but I just want to see if maybe it's the same thing and we just were not connected together and we ended up in the same path. So tell me what's changed in the way you treat things.
Sure. That's a really good thing to think about. Well, first of all, being over there, shall we say, in the Middle East, it's amazing the combinations of parents. You know, one child might have a mom who's West African and the dad who's Chinese. Honestly, we have so many combinations. It's incredible. And so that's been a real interesting thing to understand and try to put norms to all of these, because our Steiner norms from way back when just aren't cutting it. You know, we can't go on that one 15-year-old beautiful Caucasian girl and think that's going to fit all these different kids. So that's been an interesting thing to learn and work with getting those norms. Another thing that's fascinating is that the people there in general are expats. Many of them are from the United States. Many of them are Westerners if they're not from the United States, and I'm talking Great Britain and Germany and France, and so that's been an interesting experience. But one of the things that I would say has probably changed the most is when I have had the wonderful opportunity to have I counted the other day, over 1,500 ortho patient cases, quote unquote, from the years in Abu Dhabi. My understanding, my learning, my approach, how I deal with things, how I see things, how I diagnose has expanded. It's the same thing that happens to all of us. You've done it too. We grow from everything. And the learning and growth that I've experienced there has made me so much better, so much more instinctual about how I'm going to approach things. It's amazing. However, one of the areas that was always a very difficult area for me was the fact that so many of our class 2 patients and class 3 patients were very difficult to get anterior posterior correction on. And that was very frustrating. And every time I would see a class 2, which is the majority of our patients, at least it has been for me, I would think, okay, here we go. We've got to work on this and figure this out. Well, when I discovered that now we have a couple of great appliances, can we talk about the appliances that I've been using?
Absolutely. That's what I think everybody wants to hear about.
Okay, and I think you're using these as well. But the thing is, one of the things that I've been doing is using appliances that get anterior posterior correction first. Then I end up with a much more simple class 1 malocclusion to treat. And it has cut my treatment time down from 2 to 4 years on some of these kids who are not real compliant with, let's say, elastic wear or whatever. And so let me tell you about these appliances as I see it, and I'd love for you to jump in because I know you're doing some of this too. There are 2 basic appliances that I've used, and those are the D2 appliance, which the D2 appliance is an Ortho Arch Company appliance. Our friend Lindsay Graham developed that. And that is one of them. And the other one is made by Shine Now, but actually it was a Lindsay Graham appliance too in the first place. He worked with Dr. Louis Carriere, who developed the Motion appliance. At first it was called the Carriere appliance, but now it's called the Motion. So here we have the 2 appliances that either one of them are put onto either a canine to a molar, or you can put it onto a first bicuspid to a molar, or you can even use it in mixed dentition, which I love, because that means I can take a kid with let's say protrusive incisors that are out to Timbuktu and a class 2, and I can put this appliance on in mixed dentition. And what happens is it is just a little bar, either one of them, slightly different look to them, that goes from the one tooth to the molar. And then I use a lingual arch on the lower because you can use an S. Yeah, okay. Because we like to know for sure that our patients don't have to have any.
Because we're pediatric dentists, and we know that if something's removable, they won't wear it.
That's right. You got it. So here we are with the lingual arch on the lower, with the hooks on the 6s, on the lower 6-year molars. And we've got an elastic going from the canine or bicuspid or D, first primary molar, so it's a class 2 elastic down to the first permanent molar. Well, they wear those initially for the first 3 to 5 months. Now, people might say, well, I thought you said you don't like the compliance issues. That's the thing that's so funny about it. The psychology is incredible, right? Because they don't, I'm going to say, get their braces, quote unquote, until their, quote, bite is corrected. When I tell a mother, forget the child doesn't know what that means. They're like, can I get my braces? Can I get my braces? Not until your bite's corrected. The mother says, Johnny, you're going to wear these rubber bands. They haven't had braces on. They're not sick of them. It's the first thing in their mouth. And in 3 to 5 months, they have class 1 molars.
It's
amazing, right?
It is amazing.
And the compliance is what I call easy peasy. I mean, they don't mind doing it. Now, I've had a few kids that, granted, they lack the compliance even for that, but I'm holding a linchpin, so to speak. No braces. And a mother will say, you mean we can't get the braces until he wears these? Right. And I'm putting it in the context that it's not good for him. I'm going to do the best for him by getting the, quote, bite corrected before we put on the braces to get the teeth straight in the front. Amazing, right?
Well, the way,
and so they wear the elastic.
As you know, on Orthodontic Smiles a few weeks back, few episodes back, I interviewed Dr. Luis Carrier. Right. What an interesting conversation we had about it. And because he is absolutely pushing sagittal first. Sagittal first, meaning let's put the appliance in no matter what. Let's put the appliance in first, get the molars in the correct relationship, get the bite corrected, then do whatever needs to be done. And that could be expansion or that could be braces. Right. Now, you know that...
And the expansion...
I want to get your opinion about this. And I've gotten Lenny Carapace's opinion. And actually, if you go back in the literature, the opinion was if you're going to advance the mandible forward, you want to expand first. And that's the way we've been practicing for years.
That's correct.
Expand first. That will allow the mandible to come forward into the best possible position. What's your opinion about this? Now, if the reason that you're feeling this way is because of compliance, I understand that, because to get someone to be compliant is probably half the battle. But there is that component that McNamara talks about, that expanding the arch first.
Right, because it frees up, the occlusion and the mandible to settle where it, quote, wants to be. But here's the deal. When you correct the sagittal, the AP, first, with whichever appliance you're using, with the elastics, you are putting the upper molars into a relationship with a wider part of the lower, the mandible, the teeth. So now you actually may need even more expansion than you thought you needed when you started. That's number one. Number two, to answer your question, I like to say that it's almost like magic, because quite frankly, these faces look so much better. It's astounding. That's number one. Number two, the mandibles truly do position more forward, and they lose that look of no chin.
Exactly.
And I can't.
And we're talking about class 2 skeletals here. We're talking about class 2 skeletals.
Exactly.
And you're aware that Carrier originally, and I asked him this question, Carrier originally said that this was, when he called it the distalizer, the Carrier distalizer, was talking about moving the molars only. They actually were very adamant with me that this appliance was not designed for class 2 skeletals. It was designed to move the molars. Yeah. And only after using the appliance himself, he said, after I used the appliance so many times, I realized that I was getting movements that I wasn't expecting. And I always tell my students the story of the first time I used it on a skeletal class 2, and I show it on all my courses. A really significant skeletal class 2, who I was going to put in a Herbst appliance, but the Herbst appliance didn't come in on the day that the mom paid for the entire treatment. So I said, let's put this appliance in, let's see what it does. And within 2 months, he had corrected the entire class 2 skeletal. It was the most amazing thing I'd ever seen in my life, and I have it documented and prove it. But
totally.
But I got to admit that I did expand first in this particular young man.
I've done that too. However, nowadays I don't anymore, because I sometimes after the appliance I wanted to expand more, and I thought that was a little bit hard on the kids. And I'm finding I don't need to expand first to attain the skeletal change.
Well, good.
And I think even in the mixed dentition patients, I think it's even greater. And that's probably because we're having more mandibular growth, obviously. Yes. We know that.
Yeah.
At that time in their life. So I think it's fantastic. And I think that, and in fact, in Dubai, I presented mixed dentition cases with Dr. Carrier at his invitation when he was presenting his adolescent permanent teeth cases. And yeah, exactly. He agrees that we're probably catching, because he doesn't do a whole lot of the mixed dentition.
No,
you know?
no, he doesn't. And I think his approach to class 3 correction, where we were using the reverse pull headgear, I think the approach that he's using now, where he is putting an RPE on the upper and the Carrier 3 motion appliance on the lower.
Right.
Wow, what an interesting correction that is, and how quickly it corrects in the primary dentition in 3 and 4 year olds.
Absolutely.
Amazing.
Exactly. I actually took some of my motion appliances, took them to my lab, which we were fortunate to have a lab right there in the building, took them downstairs to the lab and asked them, my lab tech, to make my appliance fit the primary dentition, because I couldn't get anything small enough in standard, motion appliances, and did that. But here's the thing. I have several cases that I was sure that I was going to have to end up extracting lower bicuspids on, to treat. And indeed, with the class 3 motion appliance, in a few months, 2 to 3 months, everything was corrected. And the whole face had convexity that was beautiful. Absolutely different.
And I've been doing the same thing, and it's amazing. It is just amazing. And the one thing that we have to agree on, both of us, it turned cases that were the most difficult orthodontic cases to ever treat, class 2 skeletals and class 3s, into some of the easiest cases we've ever treated.
Exactly.
Amazing.
Exactly.
We've been through, these young people who are going through orthodontics and learning orthodontics today have not been through what we have been through. The days of headgear.
That's right.
Where we could just move a molar 1 millimeter and we were happy, and we thought that the kid was wearing the headgear. And nowadays we can correct class 2
when we're getting ready for boards and trying to get these patients to finish up for our board cases. If we had motion appliances or DQ appliances, oh my God. The other thing that you just said, these young people who are learning orthodontics, dental students and dentists in general have always seen orthodontics as an unreachable specialty. It's not accessible to them. It's a 3-year specialty program. And then after that, I guess they feel like you must know the secret sauce. And that's been kind of implied throughout our profession. And we really have to get our pediatric dentists, as well as our young general dentists, to understand that orthodontics is the future. Orthodontics is the future for them, especially for children. They're already comfortable treating children. These kids fall into the crevice between the pediatric dentist who says, I better refer them to the specialist, and the specialist who says, good, I'll take a look at them when they're 11 or 12, And here these pediatric dentists and a lot of GPs who like treating kids have already comfort levels with treating the children. They serve their patients well. And all they have to do is learn some of these skills, that using things they already know to expand their ability to change these lives. Don't you think?
It's so frustrating to me to struggle to help pediatric dentists know that this should be part of the service they're offering their children.
Of course. How can you treat a child without growth and development?
Exactly. And they already know growth and development. They are the experts in growth and development. They are so well situated to learn what needs to be learned. And it doesn't take much. The American Orthodontics Society provides such a service and such teaching that within months, if not a couple of years, they can be doing full banded comprehensive orthodontics in their practices.
Exactly. Especially with some of these appliances that we've been talking about, that actually expands their ability. We used to try to limit them initially to class 1 cases so they could get their fingers into it and they could get their head into it and wrap their head around it. But now, like you say, very quickly, they're ready to treat some of these cases that were skeletal complexities. The mission of the AOS has grown immeasurably by the fact that we have such incredible appliances at our beck and call. And, all of these people who, if they just feel an interest, a desire, boy, the AOS is right there Johnny on the spot, ready to help them do it.
Absolutely. And I am so happy that I will be seeing you in Kauai, Hawaii, at the American Academy of Pediatric Dentistry's joint meeting with the American Orthodontics Society to teach early treatment orthodontics to young pediatric dentists. I'm excited to be able to do it. It's going to be yourself, Lenny Carapeza, Elsa Echeverry, and myself. We figured out that between us all, we have well over 100 years of pediatric orthodontic experience, and we're willing to share that with everyone who comes to that meeting. So I'm encouraging every pediatric dentist out there in the United States and from abroad to come to Kauai on the Memorial Day weekend for this meeting. It's going to be wonderful. It's going to be the day after the American Academy of Pediatric Dentistry ends its annual meeting in Honolulu. And then it'll get a good chance for everybody to see another island. If you're going all the way out to the Hawaiian Islands, might as well see another island.
And how can they get information on the meeting, Eddie?
All they have to do is contact the American Academy of Pediatric Dentistry or the American Orthodontics Society, and they can do that by going to www.orthodontics.com and find out everything they need to know about the meeting. But I don't want to forget that, we talked about your blog, and I want you to be able to tell us about how we can listen to your blog.
Well, my blog is the videos and the written blogs are on my website, which is accessed either at drchrisbaker.com or loveandorthodontics.com. It's going to take you to the same place, so whatever's easier to remember, and there it is. Lots of fun, lots of topics, and I even did a video that I'm going to put up pretty soon that I loved what I titled it. I entitled it the politically incorrect way to manage the child patient that parents actually love. So that's going to be a fun one.
That's a fun one. One of the things that I really, really enjoy about the blog is looking at all the pictures that Claude, your husband, puts up in Dubai. What a beautiful place that is. It's just,
and he's so great
one day to go there. Yeah, they're really
and you're welcome to. You're welcome to come anytime.
You've invited me often, and I appreciate that so much. Chris, I can't thank you enough for being on Orthodontic Smiles. This has been one of the most stimulating of all of the Orthodontic Smiles podcasts that we've had, and I got to thank you so much. I knew it would be good talking to you.
Thank you. You're
doing
such a great
excited
job.
About doing
and
orthodontics.
It was so much fun.
It is fun to talk about. It's fun to do. So I want to thank you so much, and I hope you look forward to listening to yourself on Orthodontic Smiles. So thank you so much.
Thank you. Eddie, good job. Thank you so much. What a pleasure it's been. Thank you.
This is your host, Dr. Ed Gonzalez. I want to thank you for listening to Orthodontic Smiles today. If you enjoyed our broadcast, please click the subscribe button. We'll be in touch with you in the future about our further broadcasts. Thanks for listening.